Thank you for being here. So we're going to talk a little bit about caregiver burnout for those of you that are caring for people around you, your loved ones, your family, or if you have someone in your life that is a caregiver and you want to learn how to support them more. Next slide. So we'll go ahead and identify burnout. What is burnout? It is a condition of feeling exhausted, listless, unable to cope. It can look very different in different ways. The American Medical Association has actually developed a questionnaire to determine what level of burnout you are experiencing. But if you don't have that assessment available to you, warning signs are anger, frustration, a lack of patience, anxiety. It can be denial about your loved one's condition. We're taking in a lot of information at this time. There is a level of anticipatory grief that we're experiencing as we learn of maybe a terminal illness or how our loved ones are becoming incapacitated. So that's a lot of information to take in. There can be a level of depression or depressive symptoms, exhaustion that makes it tough to complete your daily tasks, health problems, inability to concentrate, a lack of attention span, kind of a fog, maybe some memory or retention issues, irritability, moodiness, sleeplessness, or maybe sleeping too much, social withdrawal from friends and activities that you used to enjoy. If you're noticing this coming up, we have some solutions for you later in this presentation. The Caregiver Self-Assessment Questionnaire is available. It's just probably a simple Google search. Like I said, it was developed by the American Medical Association, and it offers 16 questions to assess yourself. And then at the end, there are some resources. So if you can look into that, if that's something that might be helpful to you. Another way to assess is just what we feel, what we're experiencing. In addition to the list that I provided, extremely tired, uninterested in things they used to enjoy, hopeless, helpless, forgetful, or foggy. So if you're just feeling like that familiar sense of yourself is disappearing, we don't want you to lose hope. We want to relay a sense of optimism that we might be able to identify some resources for you. Caregivers are often so concerned with caring for their loved ones' needs that they lose sight of their own well-being. As a caregiver, you're given a huge role change that can contribute to strain, a lot of responsibilities, someone else's calendar of doctor's appointments in addition to your own. So it can be pretty overwhelming. So let's be mindful of any of these signs and symptoms we can keep an eye on. Risk factors. One of the things that might contribute to this overwhelming new role strain is living with the person that you are caring for. You're out of your comfort zone. You're out of your routines a little bit. Social isolations. Sometimes we come into this role with gusto and we cut off contact with those that are our refuge, that replenish our spirit. Having depression already before you're given this new responsibility. Financial difficulties, that strain of, did you have to quit going to work? Did it reduce your income as you apply for maybe the Family Medical Leave Act, but it's a reduction in the income that you're used to? Higher number of hours spent caregiving. If we haven't refined our skill in delegating or asking for help, and we're trying to do everything on our own, that can be a 24-hour job. Lack of coping skills and difficulty solving problems. Sometimes this is just a huge change, and these are skills that we need to grow. So let's explore the causes to increase grace and understanding towards yourself or the caregiver in your life. Sometimes there's resentment. If there was a lack of choice in being a caregiver, if we have a large sibling set or any siblings, and they're not either in the state or near us, and you're taking on a lot on your own. So important facts to consider when you're assessing your situation. Caregivers are more likely than non-caregivers to describe their health as poor. Caregivers are 2 to 3 times more likely than the general public to take prescription medication for anxiety, insomnia, depression. These are very real medical conditions, but maybe with some tools that we have today that we can reduce those symptoms or realize that it is actually burnout and not necessarily depression or an anxiety disorder. We're just overwhelmed, and that is a very real human condition and real reaction to increased stressors in our life. Caregivers face the risk of burnout and compassion fatigue, and that looks like anxiety, that looks like depression. Caregiving itself does not cause illness or burnout. The unmanaged stress does. So it's a lot of our perception. It's a lot of our coping skills and how well we deal with stress. Stress management is the foundation of caregiver self-care and reducing that burnout. So we will get to that the stress management tips later, and hopefully we can find a little bit, some solutions to what feels very overwhelming. Again, further identifying and describing caregiver burnout. The causes of caregiver burnout looks very similar to the risk factors. Lack of control, having agency over our money, over our life, that can increase caregiver burnout. A lack of resources, not knowing the resources in our community, not having access to a social worker in our life. And so we're not really aware of what's out there for individuals if we haven't had to address these issues on our own. You become a social worker yourself when you're given that caregiver role. So sometimes there's conflicting demands as you try to balance the needs of the care recipient, coworkers if you're still trying to work, employers, knowing what kind of paid time off you have, understanding what the Family Medical Leave Act is, how you can protect your employment if you need to return to it later. A lack of privacy. We are now open to this individual's needs. There are calls around the clock. And like I said before, we may live with them. And so sometimes it's hard if you've been used to a regimen, a wind down routine, how to have a respite for yourself from your job. And all of that is going to change. Role confusion, role strain, difficulty separating your roles as caregiver, as the parent, as whether you are the daughter or son in this role, a sibling or spouse. Sometimes you became the one that delegates, and your siblings aren't used to you telling them what to do. But it's a very healthy, needed role in your family, and someone has to do it. But there's an adjustment period to receiving that information, to giving that information, to feeling like people are mad at you because you're asking for more help. Sometimes there's unreasonable demands placed upon a caregiver by other family members or the person being cared for. Sometimes there's just the assumption that because you're close to mom or dad, that you're going to take on this role. And it takes a lot of education and empathy and understanding and compassion to realize this is incredibly difficult and it's not something only one person can do. So that goes along with the unrealistic expectations, and that your place and time right now is going to change with Alzheimer and Parkinson's. Mom, dad, family may be up and about with a little bit confusion, but may eventually be bedbound. And that brings a whole new set of challenges that we need to explore. And we need to constantly stay in tune with our boundaries and what we need to say no to, even though we love our family member a great deal, that we need to really look at what our threshold is. So if you are that sibling that is out of town, or that friend that has a neighbor that is going through this, here's a little bit of information to know what's not so helpful for caregivers. Making promises you can't keep, saying that you're going to be able to sit for a spell with their individual, but you actually don't know anything about that condition. overpromising. They might really depend on that respite. They might have scheduled an appointment for themselves at that time. They might have depended on that casserole. They might need your undivided attention when you say that you're going to call. So be very mindful of your own limitations and what you're able to do before you say, call me if you need anything, because they might actually need a ton. They might really appreciate that. Making comparative and or judgmental comments. This is essentially a crisis, and sometimes these crises go on for a long time. So it's not the time that they're able to hear about your, the time that you went through this with your mom. So they might not be able to receive that information of comparing stories. Like, I remember when I went through that with my mom, this is what I did. They have that attention deficit. They are overwhelmed. They're only thinking about the here and now, and they might really need to vent unless your story is very immediately related to what they're dealing with. And you can say, here's what I did. Here's the phone number to that agency, and be able to pull away and take your stories where you need to be heard to a different support system. So they might not be able to hear about your advice that you have, as well-intended and well-meaning as it is. It's just not, it might not be the right time for them to receive it. Telling horror stories, again, with what happened with your mom, what happened when you were buried. As much as it might feel like advice, just give a little bit of information at a time and see how they receive that information. Getting angry at caregivers for the lack of emotional intelligence. They are experiencing a type of grieving, anticipatory grief, and it can feel very selfish, but at the time it's a healthy selfishness, because they are taking care of their emotional wound. They are taking care of someone that is depending on them, like the mother of a newborn. And so just try to make sure that you keep your needs in check and depend on your own support system. Even if this was your best friend and this was your support system, just be mindful that this is so incredibly hard and this is a huge change. And so we're going to try to give them grace, not get angry if they're not listening to you, if they're not hearing about your day. So ways to support the caregiver. Taking action that reduces caregiver emotional labor. That might be offering to pick up medication. See if you're on that list of individuals at the pharmacy that can pick up medication. Drop and dip, just a quick reminder, maybe dropping off some food that, but not coming in there feeling that they should either share that food or play hostess or clean their house. Really saying, I actually have somewhere to go. Here's a huge meal. I'm going to leave. Unless they have asked for that time, that, kind of assess that. But sometimes they're embarrassed by their household. You know your friend best. You hopefully can assess that caregiver's needs. But sometimes it's very challenging to play hostess. Sometimes they're not showering as much as they want to. So try to do the drop and dip, and then try to say, do you want me to stay and listen? Do you want me to schedule a time where you can go take care of yourself while I, care for your loved one? So try a variety of ways, because everybody's needs are different. Try not to force them in decision-making for simple things. Again, everybody's needs are different. Some people like to be just removed from that complicated problem-solving dilemma, as to taking care of your needs. So you can say, I'm going to go ahead and do this. I'm going to stay for an hour. I'm going to take care of your loved one as much as I possibly can. Maybe you go in the other room and take a nap or a shower. Whereas maybe someone, just wants to tell you what they need. Just try a variety of different approaches, because people handle things differently. How much emotional energy do you have? Can you listen? Do something that matches it. Can you spend an hour? Can you spend a half hour? Can you truly give them your undivided attention to listen, or to put all of your obligations and responsibilities aside? Is trying something better than doing nothing? Maybe engage with a friend group and see if you can delegate amongst them. Who's a good cook? Who, has a little time to spare? Which one's retired? Try to see if we can have a variety of approaches with our friend that's a caregiver. So we understand that you cannot fix the problem, but at least try not to add to it. This is life and death for them. They are wearing a lot of guilt, a lot of what ifs, a lot of how should I. Give yourself and them grace. Offer the gift of your time. Give space when they tell you that they need it without us getting our feelings hurt. Don't exclude them. They might decline a lot of invites, but there might be an option for respite. So make sure that they feel included if you're still doing lunch and brunch or a little Zoom happy hour. Let them know that you haven't forgotten about them. Even if they canceled the last minute, you know that friend of yours is still there and they want to hear how you're doing. Offer to take them out, follow through with that. Don't forget them. Encourage them to use all the resources that are available to them. If you learn about a resource, drop off a flyer. If you heard about it or used them, talk about how they were helpful, how they were not helpful. And take care of yourself too, everybody. It's always important. All right, we touched a little bit upon guilt, guilt to that caregiver. It's essentially putting today's knowledge on yesterday's problems. There's so much regret. I wish I would have, conversations we didn't get to have as our parent, our loved one is losing their capacities. So this happens after our friends, family, and loved ones pass away. How could I have done this differently? So just be aware that it's incredibly normal, but we know that you're doing the best that you can as a caregiver. It grows from anger, frustration, not knowing, trying to do the best that you can with what you are given. And that doesn't always include having been through this experience or being able to have that conversation with your parent. Again, while also experiencing anticipatory grief. So your retention, your ability to learn new skills can be limited. So it's a ton of information at once. A little bit more about guilt and how to release that guilt, that regret. Recognize your limitations. You didn't come into this role as a social worker or as a nurse. And so don't expect to know everything about this skill. There are a lot of wonderful agencies that are attempting to replicate that for you, but you've got to learn about them first. Learn to set boundaries, healthy boundaries, saying no. What are your parameters? What are you able to do? And what that you need to pull away from. Prioritize your tasks, make lists, ask for help when needed. That's not always a skill that we all have. It might be something that we need to learn. Maintain your social contacts as much as you can. It takes time to be a friend, but try to maintain those social contacts. And we're going to talk a little bit about that later. Communicate, delegate, advocate for yourself. Seek professional help if feelings become overwhelming, and know sometimes that help can be by phone. Sometimes there's counselors that come to the home. So try to be aware of that before you think, I don't have time for another appointment. Focus on the good that you are doing and the dignity that you're providing. Sometimes your loved one really just wanted to be home and that was their only wish. They didn't plan to be a burden and they are dealing with their own pressures and changes. But sometimes just being home is the best gift that you can give them, and you are doing that by being there for them. If you are experiencing caregiver burnout, if you've looked at this and it looks really familiar, you've done that questionnaire and answered how you are, and it sounds like you're struggling. Here's a little bit about ways that you can cope. Give yourself a break. Here's a lot of national resources. I'm going to kind of tailor it down to what's local, but feel free to grab your phone and take a picture. These can be found on a quick internet search. Caring Bridge, Post Hope, My Lifeline, but I have not used a lot of those. So I want to explore some local resource that I have as a social worker have actually explored, but take a picture of those. Caregiver burnout may be preventable. What you can do for yourself is ask for a break, maintain connection, look at online resources, elder care locator, a place for mom. Every jurisdiction has an area agency on aging, so Stanislaus County does, but that is, that's common nationwide. Find in-person or online groups. A lot of people are looking into Facebook groups and supporting each other and cheering each other on. Joining a support group, Alzheimer's, Parkinson's, cancer groups. These are all available for Stanislaus County. We have what's called Friends Are Good Medicine. That's a huge PDF. It's on the Stanislaus County website. For example, a couple ones that appear to be active right now is a general caregiver support group, Kaiser Permanente, Stanislaus County. There's one that's operated out of a facility, an elder facility, senior living. Drop-in group for seniors, the senior access team, senior living and caregiver legal sources. The Stanislaus County calendar that's found on their website. So look at our local resources. There's a lot of support groups. If you yourself are struggling with something, and it doesn't even have to do with your role as a caregiver, depression, LGBTQ, if you're feeling isolated, we have agencies that have support groups just for women, just for people in certain age brackets. If you just want to support and connect and not even talk about this role, but just what your hobbies are. The Alzheimer's Dementia Support Center, they're on McHenry. They are there to support you. There's a mental health wellness recovery center, just peer connectors. Make sure that you're taking care of any, conditions that you went into this role with. I had mentioned the Project Hope and Friendly Visitor program. There's actually clinicians and peer support navigators that come to the home, varying levels of support, depending on whether we have mental health struggles, or if our loved one just wants to play chess or checkers, or have someone that sits with them and talks about current events. That's going to be through the Area Agency on Aging. So that's all one phone number, 209-558-8698. These resources will be at the end, but they do run a program. If you or your loved one, depending on mobility and capabilities, just need to exercise together, or if you're able to access respite at an hour or 2 hours, 3 hours at a time, our local senior center are doing classes, bingo, a walking group, yoga, Pilates. They're doing a bar class, which is like ballet. A craft circle, Tai Chi. Stay connected to your hobbies. That's how we replenish ourselves. That's how we nurture ourselves. So access that. Get a peer support group that ask about how you're doing and notice when you're gone. So nurture those positive relationships. Accept help if offered. That's another change. Sometimes we're really stoic go-getters. We're used to taking care of everything, and maybe that's why we're in this role, but it's incredibly hard. So accept help if it's offered, even if it's just take a virtual yoga class in another room while your friend is talking to mom in one room. Spend an evening with someone who's a good listener, or if you need to go to a movie or something. Keep those friends close that are funny, and maybe you just want to listen to them and they're hilarious and they talk about their day. Nurture those positive relationships. We need a variety to make sure that we stay sane. Take care of your own health. I can't say that enough. Hydrate, the yoga, the Tai Chi, strengthen your own muscles, core strength. You are still incredibly important and needed. Follow up with your physical appointments with your physician, primary care physician. Let them know that you're a caregiver, because that can sometimes deteriorate health, and they need to be mindful that your stressors have increased. but nutritious food, all of that self-care. That's a little bit more self-care. That pandemic, I hope we've heard a lot about that, but hydration, exercise, develop your own habits and strategies to maintain your own health and well-being. Take care of yourself. Try to go see a movie, go to the state theater. Limit contact when you can, keep those masks on when needed. See if there's any outdoor exercise classes. I do see those all over the place. And seek out help, whether it's a counselor that can talk to you on the phone, come to the home, do a telepsych. Join a support group. There's also a friendship line for seniors. That can be for you, that can be for grandma or mom. The friendship line for seniors, quick Google research, but it's 1-888-670-1360. There's another phone kind of support group, but it's more for hobbies. It used to be called the Senior Center Without Walls. I think it's called Well Connected for seniors, but the website is called covia.org, COVIA. They actually have a catalog as if you're taking college courses where you can talk about bird watching, where you can talk about nutrition, old movies. So you're essentially just on the phone talking about your interests, make some connections, any hobbies you have, stamp collecting. I don't know, but look into that, covia.org. That's been around for years. If your mom is not mobile, but wants to chat about, her time in the 50s, cruising McHenry, I don't know, whatever they're talking about. So again, these resources, here's some more strategies for self-care. I think we've gone over a lot of them. Video chat. Hey, if your grandchildren have VR goggles and they're not using them, virtual reality is really popular right now. It's in a lot of homes of young children. You can actually slide those VR goggles on, watch a movie with a friend if your children relinquish those. Real popular. How to still feel connected. Zoom, chat. Hold family meals by video, be a part of these things, ask for family recipes, talk to local social workers, reach out if you're not able to connect with Area Agency on Aging, even though I think that's a wealth of knowledge, and you'll find a social worker there that can connect with anything that you're struggling with. So many programs under that one roof at 3500 Coffee Road. Create a playlist. If your loved one still is able to talk, ask them about their history, ask how they met their husband. Sometimes memory loss happens in a different portion of their brain. They might not know what they had for breakfast, but they'll remember that dance that they met your dad in, and they'll tell you with great detail. So ask them about that. You'll be surprised. Create an oral history. Talk to them in different decades of their life. They might still retain that information. It's very connecting. Here's a lot of those resources that I talked about. In regards to respite, the Family Caregiver Support Program, that phone number through the Area Agency on Aging, you may be eligible to up to about 39, 40 hours of respite, depending on where they're at in their fiscal year. If your loved one is a Medicare recipient, that is a in-home care agency. They will have them come to the home for short respite periods. Go get that Tai Chi class, go get that yoga class, go have lunch with a friend. So see if you're eligible to that. If your loved one is a Medi-Cal recipient, you might be eligible to the IHSS and in-home support services. That is someone your neighbor, a loved one that can be paid to take care of the person that you're caring for. So divvy up that responsibility. Paid caregivers for respite. That's going to be a lot of in-home care agencies that we have in this area that you would pay for. The Family Medical Leave Act, research that to protect your job, and maybe apply for some funds so you can take about 6 weeks off and care for someone if that's a short-lived medical condition. The Move Bridges program, that's also on that Coffee Road in that same business suite. They can pay you to mileage to take your loved one to their appointments, or you can pay that neighbor that wants to help, gas mileage to take mom to her doctor's appointments. If any of you out, if anybody is no longer driving, they can teach you how to use public resources. So Bridges is mileage reimbursement. Move is to help anybody learn how to use public transportation. They'll follow you, they'll sit with you, they'll go with you over and over again. So you can go out in the world without using a car. Veterans Administration, if the person that you're caring for is a veteran, research to see, if they had an honorable discharge, if they have benefits available to them, you might be able to be paid for what's called aid and attendance to give them that care because they're at home instead of in placement. That number is 209-558-7380. We talked a little bit about the role you play as a social worker. HICAP is going to be your best friend if your loved one has Medicare, Medicare Part D, all that enrollment, Medicare Part A, B, all of that. If any of that is challenging, these are your individuals. They will call Social Security. They will call Medicare. They will explain all that mail that you're getting, how to enroll in the prescription drug plan. Healthy Aging Association, they monitor all those exercise programs. I could go on forever. There's a senior stride coming up in September, put on by the Rotary Club. Connect with some friends, go do that in the nice fall weather. And I think that about covers it. Senior Awareness Day, a lot of this in their brochures and these agencies will be at the Stanislaus County Library, August 18th in the morning. Go to the farmer's market and go get some brochures. Maybe there's some stuff I didn't cover here, but I think that about covers it.
Thank you, Erica. You did a really great job going into detail on all of that. We have a question here in our chat box. It says, how do you separate your role as a caregiver versus your role as a family member, friend, etc.?
With the person that you're caring for, that's going to be such increased communication. You are going to wear so many hats. You are going to be a social worker. You are going to be the mom. You are going to be the parent. Roles reverse. It's going to be communication. You might want to ask for someone to sit in. There's a lot of difficult conversations that are going to happen. And so I think I covered it in our topic last week on a training that might be on our YouTube channel about asking for assistance. As your parents age and people that you care about age, you're going to have to sit down and talk about estate planning, placing somebody, whether hospice philosophy is going to better meet our needs. It changes the expectations of your role. And so sometimes the best thing is to ask for a social worker, a friend, a loved one, to make it a family meeting. It's a change, it's a challenge, and it would be helpful to reach out to someone.
Thank you. There's a comment here from Miss Rita. It says, it's so important to not exclude caregivers. I already felt isolated. It's great to still be included. And then I have a question. It's not in the chat box, but I noticed a lot of this is towards, I guess, older people that are being cared for. Are you able to use the same resources for maybe someone younger who is in need of care?
Yeah, wow, that's a whole other category. Yes, for people that are caring for their children or individuals with developmental disabilities, that seems like actually a whole other training. There's support groups, special needs in our neighborhood, Valley Mountain Regional Center. It's not something I did a lot of research today, so I don't have it all on the top of my head, but please.
Okay.
Yeah, I feel like that's a whole other category. I hate to have left them out. I know there's some strong warrior moms and dads caring for all kinds of ages, and valid representation. I think that would be another training. Great suggestion.
And there's a message here from Richard. It says, will we be able to get a copy of this PowerPoint after the presentation? So We actually put all of this video, it will be on the Community Hospice YouTube channel. So everything is being recorded. So you'll have access if you need to rewatch it or any of the previous ones also. Are there any other questions? All right, thank you so much, Erica. Like I said, you did a really great job. If anybody needs any additional resources, you're welcome to call Community Hospice at 209-578-6300, or you can visit our website at hospiceheart.org. And our next presentation will be on September 8th on stress management. Okay, and that's everything. Thank you for joining. Have a good day.